The healthcare industry often gets a bad rap for being behind the technical times. Patient expectations have evolved rapidly over the last few years, and doctors and hospitals have struggled to keep up. This is understandable, as it's imperative that there be no decline in the quality of service delivered during any digital transformation they might choose to undergo. Historically, this tendency to remain a technology laggard was fine. No one was going to get hurt because they made an extra trip to the doctor's office or spoke to a hospital a couple more times than necessary. But in the last month, times have officially changed. How can a doctor, a hospital, or a pharmaceutical company deliver high-quality, personalized services to its patients in a time when being socially distant is literally a government mandate? Well, today we are going to explore just that. This video will demonstrate how a healthcare operation can leverage Five9 to evolve the service it delivers to its patients during times of calm and crisis. My name is Erin Wilson, a Director of Solution Consulting at Five9, and I'd like to introduce you to Steve. Steve just turned 40, technically making him a millennial, but he'd prefer you not call him one. He works as an on-site consultant providing business services to manufacturing companies. But this story doesn't start today. It started back in February when Steve dropped a suitcase on his foot while trying to hurry off an airplane for a meeting. It hurt, but he was already running late, so he had no choice but to try to walk it off. Later that night, however, his foot still hurt, so he went on to his favorite healthcare website to look for help. After some reading, Steve wanted to speak to a nurse. Five9's visual IVR makes it easy for the hospital to triage Steve's request. Ultimately, his chat is routed to Nurse Nancy. She suggests he ice the injury and monitor it for swelling. Steve complies and goes to bed, feeling better. But a few weeks go by, and Steve still found himself limping as he walked through airports. It was time to see someone. So Steve returned to the website and was able to book an appointment online. Steve received a text with his appointment information. In 10 short days, he would meet Dr. Fuller, the podiatrist. Then the next day, Steve received an email from his company telling him that, until further notice, due to the recommendation of the CDC, all travel is suspended. Initially, Steve was relieved not to have to limp around on his bum leg, but then it dawned on him. If it's too dangerous to fly, is it really safe to go to the hospital? Steve went back to the text message he received from the doctor's office and replied to ask whether he should come in. The text was routed to an agent named Mike. Mike was presented with Steve's entire history. He reviewed the conversation with Nurse Nancy and saw Steve's upcoming appointment. Mike could tell that Steve was really worried, so he asked if it was okay to give him a call. As they spoke live, Mike empathetically listened to Steve's concerns. But Mike was not sure if that specific doctor's office was closing. He needed a conference and a back office user. Since Five9 is pre-integrated with many UC platforms, Mike can easily see who's available at the office and conference them in. Steve gets the answer he needs and plans to come in as scheduled next week. But as we know, things change quickly. A few days later, the hospital asked its doctors to consider telemedicine for all non-emergent cases. This was a big change for them, but because the hospital was already on the Five9 platform, it was much easier. They leveraged Five9's expertise and were able to train up doctors on the application and allow them to work from home. Steve received a proactive notification from the Five9 When-Do module that included instructions for his upcoming teleappointment. And when the day arrived, his phone rang right on time. The doctor reviewed the omnichannel history, received a screen pop of Steve's medical chart, and easily initiated the video conference so he could ask Steve to show him the affected area. For the sake of Steve's privacy, we'll leave the story here, knowing that Steve is in great hands interacting with his doctor in a quarantine-friendly, HIPAA-compliant manner. So today we've seen how Five9 helped this healthcare provider to service their clients during times of calm, with great features like automated appointment setting, visual IVR, and chatting with a nurse. Then we saw how they might leverage Five9's more advanced feature set, like proactive communication and video calls during an emergency. Five9 knows healthcare. Leading companies like Teladoc and McKesson use the Five9 platform to deliver exceptional patient experiences. To learn more about what Five9 can do for you, visit five9.com or contact your sales rep. Thanks for listening and have a wonderful day.